Hello everyone, welcome to Course C Session 2. The topic here is workforce planning, as most of these courses are at the moment. Course C is on WRaPT Plan, and this is Session 2. What a plan looks like follows on, unsurprisingly, from Session 1, which is how to pull a plan together. This is the last in the series for WRaPT Plan, although there are lots of extra courses that are worth you looking at, including one on metrics and the 7 R's, which are all worth looking at to help develop your plan. To introduce myself, my name's Colin Lurie. I run Carados Limited, which is a management training and development company. We focus on building skills in all sorts of different areas, including workforce planning, which is a common thread through a lot of the work that we do. We also work with Lancashire and South Cumbria, NHS Foundation Trust and Health Education in England to provide and support the WRaPT tool, which is delivered by these great guys here. WRaPT is a free-to-use online secure workforce modelling tool, as it says at the bottom. We'd probably come up with a better name if we thought it was still going to be going after 8 years. It provides a workforce repository to store data, and it's got a scenario planning tool and loads of other fun features on it. It's run by this team here, based at Lancashire and South Cumbria, and they and I use our planning, redesign and modelling approach, which includes the free model and free approaches to help train people and develop them and deliver workforce planning projects. So that's who we are. How we do it is important, which is why we mention it every time. Key thing is that we provide free tools and techniques, but you need to provide the capacity to do this work. And the only way you tend to do that is if you can engage your organisation in giving you the time to do that. And the only way you can do that is to move to the point of the pyramid or tetrahedron we're still not sure which, to work out what you're actually going to deliver, as in what project you're going to deliver. And that takes capacity, because it takes a while to actually deliver one of these projects, but it's the only way in which you can really learn. But one of the key things you do need to know how to do it, and that's what these courses are about. So this module. So we've talked about workforce planning. We've got various other courses on what it is. So basically an overview, how to redesign it, which is the big one, the 5-course special. How to use the free workforce modelling tool WRaPT. We're going to talk about the features of a workforce hub in course D. And then there's some stuff on frontline workforce planning and a project to really get that going in E. But this is C, workforce plan and strategy. Last time we looked at developing the plan. This time we'll look at what a workforce plan looks like. And we're going to look at the types of plan. We're going to look at the sections of a plan. And then we're also going to discuss showing different versions of the future to make sure this plan is something real and not something a bit fake. So that's what we're going to cover today. High level, as we talked about last time, the WRaPT redesign approach is also really useful here because it helps you think through the process that you need to follow to do anything really. Properly scoping and mobilising, understanding your current state, developing your future state, modelling your future state and implementing. It is the core WRaPT approach that we have used for many years, and it is worth doing the WRaPT redesign course as part of doing the WRaPT plan course, because a lot of the stuff is in there. The reason why this course is so short is we are not repeating ourselves from that course too much. So let's get into what a plan looks like. Now, I will record at some point an actual plan which has been anonymised and go through it area by area, but it takes a lot of work to anonymise these plans, make sure we don't slip anything in, so I haven't done it yet. But what a plan does look like, well, first of all, it depends. Is it a full-on plan or is it a plan to a plan? So we talked last time. A full-on plan could be one where we've really gone into the detail about exactly what's changing and by when, and really detailed specific interactions within projects or interventions within projects. It could be a plan to get to a plan where we just describe the 10 projects that we're doing, and it's more likely at this stage to be that plan to a plan, because who has redesigned cancer across their entire system? Who's redesigned anything across their entire system at time of recording? which is in 2021, I think you'd have got quite far ahead of yourself. There's a few things you might have done. MSK services, for example, may well have been done. You might have done the odd clear project or star generated project already. If you've done those, the detail might be in the plan, and then there might be a few more areas you need to focus on. So there could be a combination of full-on plan and plan-to-plan as well. But those are the two main types. And as we looked at last week, there are 4 things that are in a plan. All you need is a background. You need to know where we are, where we want to get to, and how do we get there. So if you want to do this on the back of it's on the back of a fag packet, but I don't know whether people still smoke these days. If you want to do it on the back of an envelope, then you might just use those 4 sections. But if you want to get more exciting than just those 4, then you might want to think about the blue blocks at the bottom, which are slightly smaller blue blocks to distinguish them from the other blue blocks, which are higher up. And they could include the things at the bottom. So start with some summaries, which we'll talk about. High-level summaries all throughout. Background, we'll talk about what detail could be in the background. We'll talk about the current state and the future state. But then we'll also talk about the case for change and make sure we got that. We can talk about what the plan looks like and the different elements of the plan. And we can talk about the appendix. And that's what we'll be talking about through here, is what does that plan actually look like? So, if you are a fan of The Simpsons, you will know of Professor Schwarzenegger, whose phrase when given a number of things to choose from was to say, I was elected to lead, not to read, which is quite a common response with lots of people I've worked with in the NHS and social care. They are very, very busy people and they don't have time to read a lot of detail. So you've really got to get a punchy bit of detail out to people quite quickly. So there are a few things to think about from summaries. First of all, you really need an executive summary at the start of your document. It should be 1 or 2 pages that just picks up a paragraph on the background, a paragraph on the issues, and a paragraph on the key points of the future with a bit of a nod to governance. Key thing is just summarise it really, really, really tightly, so that you've got something that people can very quickly see. Right, this is the way we want to work. And a picture paints 1,000 words, so worth thinking about, can we pictorially represent it so it's the thing that gets used to describe it? If you've only got a few minutes, we talk about the elevator or pitch when we were looking at the benefits case in the WRaPT redesign course 5, I think. Which would be B5 in the courses. It's worth looking at that. What you also need is a summary for each section. So as you go into each section, make sure there's a summary at the start, so that you could create a summary document just by having the executive summary and the summaries from each one. Gives you a chance to have more and more summaries. So that's why it says summaries. Just make sure you're summarising a lot through the document. So that's the summaries. What about the background, the second one? What's included in the background? Well, for me, there are a few things to think about. First of all, the international and national context. So you can always start with a bit of a view on where we are at the moment. Internationally, when it comes to health and social care, there is a significant pressure on health and social care, and nationally, obviously, there's significant pressure on health and social care. You can get a lot of the stuff to fill this in, either from other plans or from the NHS People Plan. It's worth noting the NHS People Plan as being an important element that we need to consider in our background. So what we're really trying to do with the background is set out why we need to do this, why it's important. So a quick view on the international and national context makes sense. And then something to really make it apply locally. I remember working with a trust system up in the northwest, and they were very good at really bringing in the local context about why it was important that we had this plan now. You know, do you remember the nightmare we had about this new hospital build? Can you remember the public furore about the movement of vascular services? Can you remember that workshop? These workshops we've already had about this. It helps bring in that local context so people can recognise that this is their document and not just something standard. And then key one there is the reason for the change. Why are we doing this? Because we don't need to do this. We need to convince people to do this. If we go back to Cotter, which we look at again in course B5, then it is really worth making sure we're building that vision. So really need to start saying to people, look, this is why this is important. This is why we are doing this. So that's the background. That's fairly simple. You should be able to knock that out reasonably quickly and not have too much trouble. One you can't knock out reasonably quickly is the current state, because whilst this is sort of stuff that you can do fairly autonomously, it takes a lot of effort to pull this together. Current state, if we've been gathering this from information in the workshops, from the surveys, if we're gathering this from the data analysis that we're doing, can include the following. So PESTLE or PEST analysis, political, economic, social, technological, legal and environmental, looking at all of the, it helps us to look at the risks that face. We can also do a SWOT analysis, which is strengths, weaknesses, opportunities and threats. Anything sort of high level to help us understand the context within we're operating, which we can get people to do in workshops for us, which is great. So, or we can collect this information via survey, but better to do it in a workshop. You can include org charts, some sort of view on the organisations that are involved at this stage. You don't want heavily detailed org charts. You can put those in the appendix, which we'll talk about later. But something that explains how fractured health and social care is, who the key organisations are, etc. And you can combine that with current staff numbers, which you can start really showing how many staff are in each one. You can show difference between whole-time equivalent and headcount. You can show the number of staff by different roles or different types of role, using the ESR bands plus extra ones for other areas. Whatever you want really, but providing a view on the current staff numbers is important. You can provide and should provide information on activity, because workforce planning is all about demand and activity. You are workforce planning to meet the demand that you face or the activity that you end up doing. So having a view on the activity is vital as well. Whole lot there on staff issues, and a little box around the outside, slightly mis-centered, just to give the perfectionists amongst you a slight wibble. There are 3 different areas here. One is any quantitative information on staff issues, so vacancies, training rates, sickness levels, bank and agency use, staff satisfaction, all that stuff that comes from that list in the extra course on data. You might want to throw some of that in. Some qualitative information, so anything you've gathered from interviews or from the workshops around what people are saying is good or bad about being a staff member. So those could be various different issues that people might have mentioned that we've got, we're stressed here, this process doesn't work, etc. And then highlights, so any ones where you've really identified some that have really, probably a bit of a combination of qualitative and quantitative, has said, yeah, these are real highlights. We could really dig into those in a bit more detail if you wish as well, and provide that as part of the plan. I have to say, this particular area we've gone into in more detail. Most staff issues will, spoilers, come down to leadership, so looking into that and understanding more about the current state of leadership might, for example, bear fruit, because we'll be using that later on as we go through. So lots of stuff on staff issues. What have I missed? Locations and facilities. Don't go overboard on this, but just a real map of saying, look, these are where our main staff are based. It helps to show how spread out or how centralised we are at the moment. Because one thing we might want to look at is being more or less centralised. The equipment and IT, again, high level view on what sort of digital, especially stuff we've got available. Again, showing fracture, different ESRs, different systems being used by different primary care, social teams, etc. because if we can streamline those, we can make things easier. And it might be equipment if that's particularly important, especially when it comes to radiology, because equipment can be a big part of what they are, and where that equipment located can be a fait accompli. You're not going to be moving linear accelerators around a lot. Finally, a bit of stuff on the process, the flow, anything else on wider workforce issues. There's a load of stuff you can include in the current state. Knock yourself out. Again, look at the extra course on data, well worth a consideration of what you might want to include in there. So what about the future then? So we looked at the current state, what about the future state? Well, I like to break this down into 4 parts and sort of create a kind of story through this document, because in some ways this is an engagement document. Basically what we want to say is, look, yeah, we've looked at where we are at the minute, yeah, but if we do nothing, it's going to get worse, yeah. So, you know, if we do nothing, things are going to get worse. So what do we include in there? Well, we need to include in there a view that says, you know, what's likely in terms of turnover and retention, and activity going up. You know, we're going to be saying, look, you know, at the moment it's bad, but blimey, it's going to get worse. So at this point, we're sort of at the we're a bit at the bottom of the Hollywood arc at this point. It's not going well, and then we come out of it. But if we look at the opportunity that has been set out in the good practice and the document review we talked about, then, you know, things will get better. You know, there's an opportunity for things to get better. And then we say, and we've, you know, and if we implement everything that we plan to do, because we've done this plan, and obviously we've got that through the workshops and all the stuff we talked about last time. If we do all that stuff, then, you know, this is what we could win. Yeah, if you're watching Bullseye, this is the caravan and or speedboat that you might win if we implement all of this stuff. So you're trying to take people through a bit of an arc to say, oh, it's bad at the minute. It's going to get worse if we don't do anything. But, you know, it's been shown that this can get better, and we've got a plan which is going to get us to this great place. And that's really what we're trying to show throughout it. And in terms of what that great place will look like, we've then got to give them a bit of a view. Now, it's difficult for a large system, easier for a smaller team, but something that sets out, this is what the new process will look like, or the new flow will look like, or the new care model will look like. This is what the organisation charts look like. This is how things are so much simpler. This is the workforce model that we're going to have. We're going to have these new roles. We're going to have more of these. We're going to have fewer of these. And activity and demand is going to get balanced through the workforce model outputs. And these are all the supporting changes that we're going to have, including location changes, equipment changes. But also, you know, this is the great place to work stuff. This is how we're going to solve our retention problem. This is our new recruitment process, etc., etc., etc. That's what the future is about. It's about describing that in an exciting way. Now, there is a bit of a politics problem with the future that I just wanted to raise. So when we are looking at the future from a workforce point of view, we have engaged teams to develop a view. And in the best cases that we've done, finance have been involved in those discussions, and there is a completely agreed view from everybody that says this is what the future is going to look like. Each individual project is completely aligned, and therefore we have one version of the truth that we are all following. That is the panacea, but the reality is that in many cases finance and workforce are working separately, and in many respects it's impossible to align the two without some very, very considerable engagement from executives that they're often not willing to provide, because they're also sorting out how the hell things work within their own system, and how the organisation's vying for power, etc., or vying for the right situation for good or bad reasons. Basically what it means is you end up with multiple versions of the future. You've probably seen this, and I mentioned it in the right back at the start of the WRaPT of the overview course A. One of the challenges we have is that this lack of alignment with finance, between finance and the frontline teams. So you have frontline teams saying, we've done workforce planning and we need 5 more doctors, and finance are saying, we've done the work, we've done the numbers, and we are going to need to have saved £600,000. So that means we've got 5 fewer doctors, and there's a bit of a variance there. So what you end up with is 2 different views, and you can guess which one tends to win on returns sent in centrally. And it's all sorts of reasons why it's the case. People from the centre asking for stuff which they know full well can't actually be squared, but they need to get a report into somebody. It can be a real problem. What you typically end up with is 3 different futures or multiple different futures. The way round that Manchester found for this, which was very nice, I thought, was to say, we haven't got the chance to get this aligned. We haven't got the time, we haven't got the engagement. It's just not possible to align this. So what we're going to do is we're going to tell you about all the possible futures that there are. So what they do is they give you the finance picture, which typically goes up and then down. So typically finance, they say we're going to need more money this year, but later on, don't worry, it's going to come down. Yeah. So they'll say that's why that's going to go. All right. So they'll go up and down. So typically theirs is a downwards picture after a 1-year spike to give them a year of saying, well, we told you it will go up, but don't worry, jam tomorrow. Then you've got the operational view, which will say, do you know what? We need loads of people. The activity view will say, look, we need loads of people. Activity is going to go up. And if activity is going to go up, we're going to need more and more people. Yeah. So that's the finance one, and that is the activity one. We just got more and more demand. It's going to go like that. The reality is that probably the number of staff is going to remain fairly static. And in Manchester, they got a group called, I think it was New Economy, a bit of a think tank, to work through where they thought it was going to go. And the reality is that what you're going to end up with is the number of staff is going to remain pretty constant in reality, and probably costs are going to remain pretty constant from the different challenges you've got. You've got cost pressure from one side, you've got activity pressure from the other side, and you may end up with a bit more of a middle view. And by presenting these different views, you can say to people, look, okay guys, okay grown-ups, you've got to have this conversation about where you want this to go. You've got to set what you want, because at the moment, we could give you many different views on this. And I think it's quite nice the way that they set that out, and it's well worth thinking about when you're setting out your future model. Cool. Okay, so that is the future. Okay, what about the case for change? So we mentioned the case for change there. So it comes in after the future, the case for change. A few things that we want in here. You want to create something compelling that really helps people to understand why we are doing this. So what you really want is a vision, some sort of document that says, look, we are doing this because we really want to see, this is what we're aiming to see, world-class healthcare services. It's going to look different. We want the staff to be 100% happy all the time. We want customers we want service users to be outcomes to be the best in the world. We're going to do this in a financially sustainable way. We want organisations to be all working together for the good of service users, etc., etc., etc. You've got to set what the vision is. It's got to be believable, unlike the one I've just rattled through, but it's got to be something that can really capture everybody. You've really got to set out the benefits, why we are doing this, and this is exactly what the benefits are. This is where we want to get to. And those are the 2 key things you've got to set out. Something, if you can use a rich picture to do it, sometimes you get artists involved in your future state and they can really show it well, that really show how things are going to work, great. You just need to have those vision and those benefits really set out. As I say, this is really the this is what you can win section, where you really say to people, picking up from the future state, this is what you can win. You also do need to give people alternatives. For me, it often comes down to that this is what they're describing, what we said in the future state around this is the worst situation. But we do need to give people alternatives in terms of saying, look, you can have this or you can have this. Depends on how far you want to go. When it comes to engagement with the public, it's not always entirely rational, as we found from various decisions that have been made with referenda and stuff. So you've got to, sometimes you just need to be able to offer alternatives to people, to say, we think we can produce this beautiful vision of the future, but it requires these changes. You might want to have less of that vision of the future if you don't want quite as many changes. The key part for this here is to really show what people are getting from a change, a strategy, not what people are losing, which is often what gets focused on. So we often see at RES, well, we're going to do all this stuff and that's going to result in fewer GPs. All right, okay, brilliant. Well, I don't want fewer GPs. I can't see my GP already. What the hell's going on? I want to get in there. What you want to say is, what we're going to give you is, a GP-led multidisciplinary teams available online with social prescribers available, etc., etc., etc. Describe what you're going to get, not what you're going to lose. And then you get into the plan. Okay, what's the plan? But the plan isn't as simple as just a plan. For me, it fits into two things, and I probably could mention other things as well. So in terms of the plan, first thing is projects. So we do need to set out what are the actual projects themselves, who's in charge of them, what the project is, what the plan is, the expected benefits, the risks, and the costs, stroke the assistance needed, and that you want to engage with. Depending on it, that could be a really detailed plan for each one over multiple pages. It could also be a very short plan just on a page that explains it. You may also need to include an impact assessment for healthcare, which needs to get in there in terms of the impact on various groups, etc. But you certainly do need to have a plan in there for each of the projects that are going forward, so you can go forward from that. The other part of that is you may or may not have some sort of engagement plan in there, and you may or may not have some sort of benefits realisation plan in there. The reason why I only mention projects is because some of this stuff is a bit, in a detailed plan, yes you would. In a high level plan, which is the plans I tend to put together, you wouldn't necessarily go into too much detail around benefits realisation planning, etc. But something in there around those would be good. What you also need is an implementation approach, which should include the details of the governance, so any sort of steering group, maybe a terms of reference, depending on what the audience is, how often they're going to meet, etc. It should be in there. Basically consider elements from the mobilise. How are we going to govern this program? How are we going to make sure that it does actually get implemented? And then secondly, part of that, it's very difficult for governance to work on its own, so you may want to talk about what the hub approach is as well. So you include that in there as well. So I'll talk about hub in course D1, but you need to talk about not only one of the projects, but how we're going to implement them, to give people the confidence that they will be implemented. And then finally, you'll be glad to hear, appendices. Knock yourself out with the appendices. Depends what you want to include. If it's for public consumption, make sure you're not embedding documents that you don't want people to see. Make sure you're not copying in Excel tables and copying in the entire Excel file as well, just from a GDPR point of view. But from an appendices point of view, you might want to talk about your people you've engaged, the process we followed, the document review list and outputs. You might want to put the workshop outputs in. You might want to put loads of data in, additional graphs that you haven't included in the main part, and loads of detail if you want it. As I say, knock yourself out with those things. Few key things that may go into bigger ones are certainly the engagement and consultation documents. So copies of those. They can often go into these the business cases. And options appraisals, and also detailed workforce models theoretically can go into plans. You can have a load of stuff in there. At the end of the day, what are you doing it for? Sometimes, I say again, when I worked at Finnemore, they did always used to refer to the thud. Sometimes having a thick document in its own right makes people think, oh blimey, that must be a good document. But you do need to think about what are we including those appendices for, and there is a lot of work to make sure they line up with the main document, and the more stuff you put in, the more risk you've got of putting something out you didn't intend to put out. So I would minimise the appendices just down to anything you've had to take out of the main document in order to make it flow better, or to bring its size down, should really be what you include in the appendices. You shouldn't really include a lot of it. Another option is to have a separate appendix document, because one good thing about using appendices is it does keep the stuff together, and that years after the project, when people want to know stuff, you've probably deleted all your other files, you've moved on or whatever else, and you've lost them. Whereas if there is a document with them in, they always exist. As I say, a recent mental health redesign we did in Chorley, the appendices did include a load of stuff, and that means there's still public access to those, which wouldn't otherwise have been the case, as I've moved organisation since. So it's well worth making sure all that stuff is there, but possibly in a separate document, to avoid too big a document. And hey, think about the trees when you're printing them. Right, that is it really. That is what needs to go into a plan. In conclusion, I won't bring it here because it's actually behind a light access firewall, but if you follow this link, you can gain access to have a look at the Manchester strategy if you wish. You would need to log on and get access to the GM Workforce Futures group, but it is there and available to use, and there is a nice view on a one-page executive summary for the strategy, which shows what they've come up with in terms of the strategic priorities that they were following on from a load of engagement they did with a lot of people a couple of years ago. Obviously, healthcare has gone through a lot since, so I don't expect it all to have been implemented, but it is an interesting document. As I say, I will do a separate presentation taking people through a workforce plan at some point, so strategy or plan, so that people can see what is or isn't included in one. But well worth a look. If you can sign up to Workforce Futures, you will get free access. If you're NHS, you'll get access straight away, and you can have a look at this plan. Cool. Okay, I'll leave it there. That is the plan and what it involves. Don't forget, if you haven't, make sure you've looked at the previous course on WRaPT plan, course C1. And if you didn't understand stuff of that because you haven't done the WRaPT redesign course, then please do the WRaPT redesign course. Also consider the WRaPT hub course, which will be online pretty soon, and have a look at the WRaPT frontline course for building skills in workforce planning in frontline teams. There are various other resources to look at. I've said these a number of times. Register to the WRaPT tool. Buy the bumper book of health and care workforce planning when it's on Amazon. Shouldn't be long. Visit the WRaPT website, the Health Education England website, or the Carados website for more information and resources. Thanks all. I hope you found this useful. I hope you found the whole course useful. Please leave your comments on this video. Get in touch with me through the Carados website. Ding the bell, like, subscribe, etc., etc., etc. All those things you need to do. Have a great day. Cheers, guys.